everyone, I'm Samia. I'm an occupational therapist. I'm working in Intensive Rehabilitation Service at now. I completed my Bachelor of Science in Occupational Therapy in 2019. I nearly 3 years I worked as a pediatric occupational therapist in Bangladesh. Then I moved to the UK in 2023 for my master's degree, and I completed my master's degree in public health. I'm working in IRS since 2024. I joined there as a band 5 OT, and then now I'm working as a band 6 OT here in IRS. So in IRS, it's like intensive rehabilitation service. We work in community with the patient, and we consist of team of physiotherapy and occupational therapists. We aim to help people after their discharge from hospital, and we help them to avoid hospital admission. We try to help them to so that they can participate in their community, back to their baseline, and we help them to participate in their daily living activities and like so that they can function well in community. If you wanted to know more about me, you can see the link in description. Here I share my journey in preceptorship newsletter. When I worked as a band 5 OT, I got opportunity to enroll in preceptorship program. My team and the preceptorship program both helped me to make me more confident in my role. So you can check the link below in description and you will find out more about me. A day in the life of IRS, as I explained that like we work in community. So at first, our day start with flash meeting. It's really important for us to ensure that like everyone is aligned, and we need to aware about any immediate concern. That's why we attend the flash meeting in the morning to make sure that like our timetable is fine, and then we manage our caseload. It's very important for us to review our caseload, any to assess the risk and level, and also any urgent need and to prioritize our caseload. So we then manage our caseload and we arrange visit in the morning so that we can plan our days. And then we visit our patient in community for their assessment and follow-up visit. And also we organize visit with other professionals like physiotherapists, sometimes with carers to provide their care plan so that they can provide the patient best care, and any changes in their care plan we organize with the care manager. So in this way, we organize the visit for the patient for patient safety. We visit patient in community. We went to see patient. If it's a first day, then we completed the initial assessment with the patient. We find out the patient like any needs for like participating in daily living activities or any problem they find it difficult to participate in daily living activities. And like if the patient is continue our session, then we for reviewing the patient, we organize the follow-up visit for next day, and this way we complete our visit with the patient. And any kind of needs, if the patient need any kind of support from our service, then we try to provide the service according to patient needs and plan goals with the patient. We discuss goals with the patient so that patient can participate in their goals and daily living activities. Documentation is very important for us as we went to see patient in community. It's really helpful for us. Like if we document properly, then it will reflect that what we have done in community, and other professional can track on like what happened with the patients, and then we can also discuss about it. And so it's very important for us to document everything like regarding any concern, any issues that we will document in our notes. And then we have like admin work, like any referrals, emails, and also like anything that we want to chase with GP, district nurse, or care agency. We done in that admin slot in admin work. Like we have also like team meeting OT meeting and physiotherapy meeting once in a month. And also we have MDT meeting once in a week. MDT meeting is very important for us to discuss about our patient progress, any concern, any issues that that's really arise. So we need to solve these together. So that's why we work in an MDT approach. So that's why like MDT team meeting happen like in once in a week. Rewards and challenges. There are several rewards. The most meaningful is impact on patient's life. In the for service, we observe like patients manage like engaging their daily living activities, like able to access the community, participate in like social events. That's really enjoy. I mean, very helpful for the patient after receiving our service, and they're very happy after getting our service. And we work holistically and like patient-centered practice because we support the patient like outcome so that the patient can participate in their daily living activities. We actually look the patient as a whole and like for patients goals, their daily routine, their environment, we look every aspect so that we provide best service to the patient. Like strong multidisciplinary collaboration is a key strength. We work together as a team. So physiotherapist, occupational therapist, and district nurse, GP, and other health professional carer, we work together so that we can provide best service to our patient. Variety in clinical work. Um, this is also very helpful, like for the patient. We work with different diagnosis patients and also like different goals with the patients to ensure that like we provide effective care to patients. There are some challenges like time management, sometimes demanding to balance the visits and also like the admin work and documentation, and the complex patient presentation. Sometimes, we need to see complex patient, but we need to be very careful about our clinical reasoning. And the emotional demands, especially particularly for the patient who have like long-term conditions. So this is the advice, like how we can overcome these challenges. This is the advice to my younger self. Like so, in every aspect, it's very necessary to ask for help when we need it. Because if we ask help, then we can find a solution. And then we need to stay organized to manage busy days. Sometimes we need to change our timetable, we need to reschedule our days if it's needed. So we need to be very flexible about this. We need to celebrate small patient achievements and we need to communicate clearly with the team and families because it's very important. If we discuss, then we get a solution. If we don't, then that means we are not able to find a solution. And we need to believe our abilities. If we find any issues or anything, then we need to believe our clinical reasoning. We need to find a way so that we can overcome the issues. Here you can see there's a link of our Intensive Rehabilitation Service website. If you wanted to know more about our service, you can check the link and the description. And also you can see there is a link about Royal College of Occupational Therapy. You wanted to know more about occupational therapy service, and then you can see the link below. Thank you very much, everyone, for listening.